Welcome to McLaren Bay Region surgery class. I'm Katie from the Infection Prevention Program, and I'd like to thank you for participating in our class. We have multiple speakers here with you to talk about the things that you can do to help prevent complications from your surgery. One complication that we are especially focused on is preventing a surgical infection. There are about 300,000 surgical infections a year, which means that unfortunately, up to 5% of the patients having surgery may go on to have an infection afterwards. Now, there is never a guarantee that you will not have an infection because there are dozens of potential causes for each infection. But by following these guidelines, you can definitely reduce your risk. Before surgery, bathing with our CHG soap, controlling your weight and diabetes, quitting smoking, and making sure your fingernails are short and clean will help reduce your risk of an infection. During surgery in the operating room, we are working very hard to maintain a sterile environment and sterile technique. And after surgery, we need your help with keeping your wound and dressing clean and dry, and washing your hands and keeping your dirty hands away from your wound and dressing. Now I'm going to turn it over to Annette to discuss the details of preparing for surgery.
My name is Annette Garulski. I'm a registered nurse with McLaren Bay Region. You will see me in the Surgical Services Department. In fact, if you have surgery, you will probably see me after your surgery in the recovery room. Today, I'm going to talk more about getting ready for your surgery, cleaning your body before your surgery, and my topic is killing germs. Ways you can help lower your chance of getting an infection after your surgery. At McLaren Bay Region, your health is number one to us. And so again, I'm going to talk a little bit about preparing for your surgery. Your surgeon will give you a welcome folder from McLaren Bay Regional Services. Your surgeon will also give you a showering kit. If you did not receive these, I instruct you to please call your surgeon. In your welcome folder, you will find all the information you will need to get ready for the day of your surgery. There are also instructions in there to help you the day of your surgery, during your surgery, and after your surgery. Also from your surgeon, you will have received a showering kit. Your showering kit should have come in a clear plastic bag, and in your showering kit there is a bottle of CHG soap and a sheet which gives you instructions on how to clean your body before your surgery. Showering. Yep, we're going to ask you to shower every day for 4 days before your surgery, plus the morning of your surgery. Now you assume everybody showers every day, but we're reminding you 4 days before your surgery, plus the morning of your surgery. So an example, if your surgery is on Friday, we ask that you shower Monday, Tuesday, Wednesday, Thursday, and the Friday morning of your surgery before you come in the hospital that day. Why so many showers, you ask? Germs on your skin can creep into your surgical wound after surgery and cause illness and infection. Our goal is to get rid of those extra germs before your day of surgery. As I said, in your showering kit, there is a sheet with showering kit instructions. Again, we're going to ask you to shower once every day for 4 days before surgery, plus the morning of your surgery. When you shower, we're going to ask you to first use your regular soap to wash. Your regular soap removes dirt that's on your body. Then we're going to ask you to repeat washing with about 1/5 of the bottle of that special CHG soap for each shower. The CHG soap creates a coating on your skin, and that coating helps to kill germs even after your shower is done. I'm going to review the showering steps, and this might sound like I'm repeating things, but I am. Again, we're going to ask you to wash your body and your hair with regular soap and shampoo. Remember places where germs can hide, like under your arms, underneath your breasts, your belly folds, your skin folds, your groin area, and your private area. Then we ask that while you're showering, you repeat again with the CHG soap. So yes, we want you to shower with your own soap and shampoo, and while you're in there, repeat washing again using the CHG soap. I do remind you though, do not use the CHG soap directly on your face or your private body parts, for it can irritate those areas. With the CHG soap, wash another 2 to 3 minutes where you are having surgery. So here's an example. If you're having left knee surgery, spend an extra 2 to 3 minutes washing that left knee with the CHG soap. Then after you've washed with both your regular soap and shampoo and the CHG soap, we ask that you rinse well, dry with a clean towel after every shower, dry your hair with a clean towel after every shower. We also ask that after your daily shower for 4 days, sleep in clean pajamas and clean sheets. If you shower in the morning, put on clean underwear daily. If possible, put clean sheets on your bed daily, the very least the night before your surgery. Remember, you will also shower the morning of your surgery. That is 5 showers with the special CHG soap. A few other ways to get rid of some of those germs that might creep into your surgical wound. I'm going to talk about your fingers and toenails. We ask that you clip your nails short and clean them before your surgery. If you wear nail polish or wear artificial nails, we ask that you remove them before the morning of your surgery. Germs live in nail polish and artificial nails. Also, we ask that you leave your rings and your jewelries at home. Here's a little guy that's sick. That could be you, or that could be people in your environment. I'm going to talk a little bit about your health before the day of your surgery. Should you develop fever, sore throat, body aches, nausea, vomiting, diarrhea, if you have any of these within the week of your surgery, call your surgeon. If these symptoms happen the evening before or the morning of your surgery, we ask you to call our main operator number, and that's on the screen here. It is 1-989-894-3000. That number can also be found in your welcome folder. When the operator answers, please tell them, "I'm having surgery with Dr. Smith, and I'm not feeling well. Would you please contact my surgeon so I can let him or her know?" Your surgeon may need to change the date of your surgery. The day of your surgery, remember, you will have showered for 4 days plus the morning before you come in. Also, once you arrive at the hospital, the nurse may also wash the surgical area and clip body hair to prevent infection. Also, make sure all caregivers, nurses, and doctors wash their hands before touching you. If you don't see them doing it, we give you permission to remind them to do so. We also may give you an antibiotic in your IV before your surgery starts. This is to help avoid an infection after your surgery. A little bit about after your surgery. You see that little dog there. I'm going to talk about pets also. But your caregivers should wash their hands before and after touching you. Again, we give you permission to remind them if you don't see it happening. Do not pick at your dressing or your incisional site, and do not allow family members or visitors to do so. Dressings are put on to protect you as your body heals. If you go home the same day as your surgery and have a dressing, follow the directions you are given for changing that dressing. Now, pets. Pets do not belong on your body where you had surgery. An example, if you've had an abdominal surgery, do not allow your cat or dog or pet to sit on your lap. And please wash your hands after feeding and caring for pets. Pets carry germs. If you happen to stay in the hospital after your surgery, we ask visitors who are sick to stay home. Any questions about any of this? Call your surgeon. Again, I remind you, please read the information in your welcome folder. Follow the instructions in your showering kit. Shower 5 times before your surgery. Together, we can help your body heal its best. Thank you.
Hi, my name is Laura and I'm a registered dietitian and certified diabetes educator at McLaren Bay Region. Today I'm going to talk about blood sugar control and nutrition management before and after your surgery. The stress of surgery most likely will increase your blood sugar, even if you have diabetes or without diabetes. Your blood sugar may become more high or have hyperglycemia, which makes it harder for your body to heal, especially wounds. The goal for those with diabetes is to have the same outcome as someone without diabetes. Before your surgery, you may be asked if you have frequent episodes of low blood sugar. Some medications may increase your blood sugar, such as steroids. Your physician may want your A1C or your hemoglobin A1C, which is your average blood sugar over 3 months, to be within goal range before surgery. On the day of the surgery, you will be asked to stop your diabetes medication. You will have your blood sugar checked before surgery, and if it is high, you may receive insulin. Even if you received insulin in the hospital, that doesn't mean you will be on insulin when you go home. The surgical staff will be checking your blood sugar hourly per protocol. After your surgery, you will resume your normal diabetes care. You will notice your blood sugars may be running a little high for a few days after surgery. However, if they continue to be high, please call your physician. Nutrition before surgery. It's very important to eat a well-balanced diet before your surgery, especially having high-quality proteins such as fish, poultry, eggs, nuts, and seeds. High-fiber foods are important as well, having whole grains, vegetables, fruits, beans, and nuts, and calcium-rich foods, which are most dairy products. It's also important before your surgery to stock your pantry, making sure you have enough foods available, or having family and friends bring you meals after your surgery. You may be not able to get out very frequently after your surgery. Sometimes your doctor may tell you to lose weight before your surgery, and if so, here are some basic tips to help with your goal. Eating smaller portions by using a smaller plate can be helpful. Eat more fruits and vegetables. Drink more water instead of high-calorie, sugary drinks. Be physically active every day, such as taking a brisk walk. Basically, sit less and move more. After your surgery, you may have a decreased appetite. Consider nutritional supplements or meal replacements such as Ensure, Boost, or Glycerna. Maintain a balanced diet to help with wound healing. Eat a high-fiber diet. Many prescription medications, such as pain medications, can cause constipation. So consider laxatives such as Senokot or Dulcolax to ease constipation. The high-fiber foods you'd want to focus on would be high-fiber cereals such as bran and wheat, beans, lentils, legumes, and peas, fruits and vegetables, and whole grain breads. But it's important to remember not to increase your fiber intake really quickly. Don't forget to increase fiber intake slowly and drink plenty of water.
Hello, my name is Dr. Martin Inheis. I'm a clinical coordinator of pharmacy for McLaren Bay Region. I'm also an associate professor of pharmacy for Fair State University. My topic today is going to be preventing surgical site infections by stopping smoking. You probably saw this cartoon before, but I think it sort of fits perfect for this talk. The real reason dinosaurs became extinct. Why is smoking bad? Obviously this doesn't relate to surgical site infections, but I really want to mention this briefly. Dramatic increase in the risk of lung cancer, especially in women, implicated in risk factors for many other forms of cancers, for lung disease. COPD stands for chronic obstructive pulmonary disease, and increases dramatically the risk of heart disease and stroke, and also makes your skin wrinkle. So for the people out there that are vain, that's a good reason to quit smoking by itself. Why do we want to quit smoking before surgery? Well, studies show that stopping smoking decreases your risk of having a surgical site infection by half. So it's really important, if at all possible, for you to quit smoking. In terms of infection, smoking increases healing time, it increases the length of hospital stay, which would make sense, obviously increases cost, and it's certainly something you want to avoid if at all possible. How does this happen? Well, your skin is, and my next slide shows us as well, your skin is highly vasculature, and smoking will cause your skin, blood vessels in your skin to constrict. That constriction decreases blood flow to your skin, decreases oxygen and nutrients to your skin, and your body's just not going to be able to heal as quickly. This is that cartoon that I told you about, and it just shows you how vasculature your skin is. Everybody's had skin cuts, and they really bleed a lot. So the smoking constricts these vessels, and thus you're going to have an increased likelihood for infection if you're a smoker. How long do I have to quit before we can show a difference in infection rate? Well, the ideal time is a month or longer. That's where studies show that it's most dramatic. So if you can stop for a week or so before your surgery, that would be a good thing, and certainly will help your cause. It's very, very difficult. You know, there are many tools. We'll pass out a couple 800 numbers you can call. But certainly talk to your doctor, talk to your surgeon, talk to your family practice doctor, talk to the pharmacist of how can I quit smoking. There are many, many different pharmacologic tools, and you've seen those on TV, and other Lung Association, Heart Association all has ways that you can quit smoking. So remember, keep your hands clean, wash your hands, lots of bathing, and if at all possible, eat properly and quit smoking. Thank you.